Yes, guys. Welcome to the platform, and it's a great day. It's a great day, man. It's a great day. We are doing our part daily and daily. Hastily going to work, and let's see. Let's see. Okay, nice. Today, I want to talk about, before we start, we want to talk about that is important. Considerations of a drug. Rahul is the first one. Big up, Rahul. Rahul, how is the everything? Now, everyone is complaining about watch hours. Watch hours, watch hours, watch hours. Hey, everyone. This YouTube is making, it wants people to work hard, not to take YouTube as a hi bro, hi. YouTube wants to don't want people to take it as a platform to jokes. They want people to make it as a hustle, and people are complaining, are saying those watch hours are so many, and to get the half lunch, bro. Oh, I'm taking some water here. It's 5:49 p.m. 5:49 p.m. Yes, now come on, and every goodie say, come and hear what I got to say. What is this? What you say? Come and listen, and I'll tell you what is the talk of the town today. The talk of the town is watch hours. YouTubers are complaining watch hours, my friend. YouTube has decided to tell people no earning while sleeping, no earning while just walking around and feeling nice, putting your cameras on hold on a specific point while people are chatting, and then you earn. Right this time around, hey man, getting 8k hours, one. Jamaican uncle, big up yourself. Welcome to the chat. Welcome to the chat. We want to go through some lessons today. If you are a new guy in the channel, you know what to do. Come and hit the like button. I also like the video too. Welcome. Good one, uncle. Good one, Jamaican uncle. And I'm saying this. I'm saying if you are a new person to this channel, and you know you are new and you are listening to me for today, instead of just walking away, hit the like button and subscribe. There is a subscription button down there. You subscribe so that you can be following when I'm live. Today we want to talk about a serious topic that is called how do we consider drugs as not over the counter and no over the counter? Which consideration are there that make you feel that this one should not be sold over the counter and this one should be sold over the counter to take care of the normal ailments? Tomorrow is the Independence Day of that country, India. Yeah, Rahul, welcome. Hope we'll celebrate Indian Independence Day. Big up yourself. Chat, come to the chat and tell us you are a new person to this channel. Come and talk to us. Come and talk. Ahmed, I can see Ahmed here. Ahmed, how is you? Big up yourself, Ahmed. How are you doing, Ahmed? Big up yourself. Big time. Big up yourself, big time. Thank you so much for considering to come and saying, peace be upon you. Ahmed, peace be upon you too. So the talk of the town is watch hours from February. I say, come on and every goodie, come and hear what I got to say. Come and I will tell you what is the talk of the town today. Cause in every corner that you may walk, You see a group of people talk. They are not skylocking. They're talking what's happening here in YouTube. Watch hours, man. Watch hours is killing everyone. If you are a YouTuber and you are watching me right now, tell me your thoughts as we discuss considerations of over-the-counter medicine. Tell me your thoughts about it. If you want to determine whether a medicine is not over-the-counter, there are several important things that you have to check. Tension, YouTube. Ahmed says there is tension everywhere. How is it possible I complete my watch hours? Just imagine, Ahmed. Watch hours to 8K. That's why I'm singing to everyone today. Come on and every goodie. Come and listen what I got to say. Come and listen and I will tell you what is the talk of the town today. The talk of the town is because in every corner that you may walk, you see a group of people talk. They are not skylocking. They are talking what's happening here in YouTube. Welcome, my people. I'm just coming in right now and you have not subscribed to the channel. Why have you not subscribed to this channel? A very good channel with good people like Ahmed and Rahul, Jamaican uncle, people like everyone that is in here today. Come on, tell us where you are watching from. Let's interact. Today we want to talk about 20 considerations for identifying a drug cannot be sold over the counter. A drug cannot be sold over the counter. There are some considerations. You go to over the counter and you watch hours complete the old man now. Raul is saying the increase in watch hours it finishes the old man. The old man cannot make all those watch hours. No worries. No worries. If you are here and you know where Panchanathan is, tell Panchanathan the doctor is online and is looking for you. So let's continue subscribing. Let's continue subscribing and liking their video. Like so that you can get more impressions so people can come. We discuss this topic. This topic we are discussing is called considerations for identifying an over-the-counter drug. Just don't go buy over-the-counter drug and then you say that I bought it over the counter. You may have bought that drug over the counter. The only problem is it will bring problems to you. Considering that you have not listened to a specialist, considering that you have not gone to a specialist to advise you about the drug. My task is complete 1,400 complete now. Oh, now. Who is watching me right now? If you are watching me right now, the person who is the host is called Benjamin, Dr. Benjamin, Dr. Ben, people call me that. And the platform is called Benjamin the Wise Guy. So, let's get on. If you are coming in, you want to feel it vibe, you want to feel it fine, tell us where you are watching from. Lot of hard. What is Anna doing? Who is Anna? Who is Anna, Rahul? Who is Anna? Anna is who? Who is Anna? And tomorrow is Friday. What we do on Fridays, we do feel good Fridays. We vibe, we feel good, we make it happen. So check it out tomorrow. I'll be coming live from here. I will be coming live from somewhere else, making it me, Rahul. Join Ahmed Guman World. Join Ahmed Guman World. So all that are watching, welcome to the platform. We want to say that the considerations that you need to have. Consider that this drug is not over. Oh, Anna means brother. Okay, I'm learning Hindi language. And Anna in Kenya means a girl. Hey, imagine Rahul, in Kenya Anna means a girl. Now, check whether the prescription is required. If the medicine legally requires a prescription from authorized healthcare profession, it is not an over-the-counter medicine. If you go to a pharmacy and then you are asked, do you have a prescription? The first thing you need to know, that drug is not over the counter. Even if it will be sold know that it is so illegally. You see? Very important point there. Very important point. So if you are a YouTuber, you have a YouTube channel, you feel the vibe, you feel the weight of what is coming through with watch hours. Please type there and tell me, hey doc, how can we do to manage? Because from February, if you are not monetized, it will need you have 8K watch hours plus 1,000 subscribers. And then the people that are monetized, if you don't have continuously 1,000 watch hours, the problem is there, you'll be demonetized. Now, that is the problem that is gonna come. What you gonna do? What you gonna do when you come for you? Hey, when hours don't come for you, what you gonna do? Say, what you gonna do when they come for you? YouTubers. So if you are depending on YouTube, you are a YouTuber, your channel is growing, man, you need to double your strength and hard work and creativity. My other elder brother is Aved, bro. Big up yourself. Big up Rahul. And if you are watching and you have not subscribed, please subscribe. If you are watching and you have not liked the channel, please like the channel. So check whether the prescription is required. Very important. Do you have, you go to, you have Googled a drug, and you feel that you need to go and buy it because the way you have read and you have gone through the notes on Google tells you this is the drug I need. Then you go and you are told, do you have a prescription? Yes, the first thing you need to put in your mind is that is not over the counter. Go and find a professional and not artificial intelligence online or Google. You see, very important point, my friend. Very important point. Check the medicine schedule classification. You just don't buy drugs, man. Don't just buy drugs. These drugs are something else. They may put you under. Check the medicine schedule and classification. Look at the official classification. If it is in Kenya, if it is in the US, if it is in, medicine may fall under categories such as general sales, pharmacy only, prescription only, on controlled or prohibited products. Yes. Ravi, big up yourself. Welcome. And he says, I'm the fourth one. Fourth like. Ravi, hit the like button. Super live. Super live. I like that, Ravi. So, check the medicine classification and schedule. When you go and buy drugs, there is medicine classification. And you can have a medicine that is generally sold. Painkillers. Some painkillers, you can buy them over the counter. You can buy them in a pharmacy, in a shop. Those are normal painkillers. Efasi Lipenga, the mother to the big YouTuber Tony Lipenga is in the house. So he's saying, greetings Benjamin the wise guy and everyone. And I'm saying, Efasi, thank you so much. Greetings to you too for coming in. I can see my friend, my lovely friend that loves to smile and feel good. Tomorrow is on Friday and we will be feeling good on Friday. And I'm saying the coffee cakes is in the house, and you guys, you don't visit the coffee cakes. You guys, if you are here, my friends, let me tell you one thing. If you are here and you feel nice, looking at Benjamin the wise guy, you should go and see the coffee cakes. Check the coffee cakes. Remy the friendly bear. Yeah, Remy the friendly bear is here. Bears can be aggressive. So Remy is that bear that is so friendly, nice, likes to play around with people. Bears with the how it looks good, and not the bear that you have at home as a teddy bear. No. The bears that are at the North Pole, good big bears. So welcome my people. I can see Remy, Rahul, Coffee Cakes, Efasi Lipenga, Remy the friendly bear. All of you, my guys, if you are here and you are not supporting your brother, Give an helping hand to your brother when she's crying loud. And that song comes with another one. Come on and every goodie, come and hear what I got to say. Come and listen and I will tell you what is the talk of the town today. Cause in every corner that you may walk, you see a group of people talk. They are not skylocking, they are talking what's happening here in YouTube. Yes. And what is happening here in YouTube is the rise in watch hours is causing panic. Panic, everyone is panicking. How will we make 8K watch hours? Whoa. Remember, the topic of the day is consideration for identifying non-over-the-counter drugs. Those non-over-the-counter drugs are like which one? We said yesterday. So today we want to consider the consideration. Check the medication classification. How are these medicine classified? General sales that you can buy in a shop, pharmacy only that should be stocked where a licensed pharmacist is, prescription only that can be given by a pharmacist from a prescribed specialist. Welcome. If you have joined the stream, please double tap. Yeah. Yes, that is the coffee cake say so. Double tap the screen. We want the likes to go up, and subscribe. Hey, subscribe, my friend. You know that what the doctor here, there, and then you're not subscribing, You subscribe so that when I'm on from tomorrow, I said from tomorrow, I'm going reggae till Sunday evening. So if you want to follow my journey for reggae, follow me from tomorrow. You will see wonders. Now I am at 2,800 watch hours. Panicking. Panic. Boss, come on and every goodie. Come on and hear what I got to say. Say that again. Come and listen and I will tell you what is the talk of the town today. So, cause in every corner that you may walk, you see a group of people talk. They are not skylocking. They are talking what's happening here in YouTube. And what are they talking about? They are talking about watch hours and people that are monetized. If you are monetized, you have to maintain 1,000 watch hours or you'll be demonetized. You will achieve the watch hours before February. No, that is not panic. YouTube is making people to know this is work and you should put more efforts. As we pay you, put more efforts. So now, let's continue. How do you feel about that? So we are check the medicine schedule classification. You don't just do 1, 2, 3 things, man, without thinking. No, go. There is a prescription medicine that you need a prescription from a person who is licensed. Yes, even the pharmacist cannot go. Work towards December. Yes, even the pharmacist cannot give you the drug. He needs a prescription from a doctor. Controlled. Those that the board of your country are controlling should not be taken anyhow. As you take the medication, the doctor is following you up and knowing the progress. If you are okay, they are removed from prescription that you're taking. And there are products that are prohibited medicine. They are only used by consultants at a very critical time. And they are prohibited from the public. You see how drugs are. You check the medicine schedules and classification. You didn't know these things. Let me tell you these things today. Prescription medicine is given by qualified medical professionals only. Yes, you take the prescription, you take to the pharmacy, and the pharmacist gives you according to law. Morphine is not prescription medicine. That is prohibited medicine. It is given only by consultant in theater under specific guidance. You see, there is difference between prescription prohibited, general, And you see, on over the counter. Now, Amar Goda laughing at the doctor. Amar Goda, how is you doing, man? You look at Amar Goda laughing at me. How are you, bro? I'm fine. I'm very cool, and my sister, the coffee cakes, is in the house. I feel nice. See, Joe Kiru is in the house, and there is my friend here always, who is Bosire, boss one is in the house. You see, these are things that you need to do what? To consider when we are going to the doctor. Oh yeah. Let me sing for you today and feel good. I'm inviting you for a weekend which will be full of vibes, and Nanda is in the house. Ananda is in the house. Big up Ananda. Big up Ananda. I can see you here feeling nice, feeling the vibe, feeling everything. So Ananda and my friends. Ananda, how are you doing? And guys, you check out Ananda. If Ananda has a YouTube channel, you have not looked at Ananda, you have not looked at Coffee Cakes, you have not looked at Jamaican Uncle, you have not looked at, you see, you guys big up yourself every time, and big up yourself yourself when you're coming to the chat, and also when you're doing ABCD. So make it happen, man. Make it happen. Work hard. Go to your brother, and then you see what a friend we have in Jesus. When you are getting ours, Dangira Diligence, welcome and subscribe. Man, if you are watching me and you have not subscribed, you are not doing a good thing. You are not doing a good thing. You have to subscribe to the channel. Yes, and I made new music video a month ago. Hey. My friend made a good video yesterday. If you wanna know a hit song, hit songs, go to the Coffee Cakes channel and see hit songs. So today we have said, look at the official classification in the Kenya medicine may fall under such categories: general sales, pharmacy only, prescription only, controlled or prohibited. So you will never get prohibited drugs in pharmacies. Those ones are gotten in hospitals and are very important. They are just removed when there is very important surgery or procedure that is going on, and they are given by consultants only, prohibited to the public. Even a pharmacist can only give if this is a pharmacist that is given that in a hospital. You see, now consider the potential of serious adverse effects. Serious adverse effects. You can take a drug and you swell your face. You can take your drug and you get anaphylactic shock. And then you start seeing shine on your way like a fireway home. We don't want to sing that when you are giving you drugs. No, we give you drugs to get better. So we don't give you drugs to pass away. No, consider the potential serious adverse effects. Medicine capable of causing serious life-threatening adverse effects are more likely to require professional supervision, and they are given in hospitals. In hospitals that are having consultants and doctors that can follow you up as you come around. As you come around, you are being given a drug. They check how you are going on. A doctor talks to you like, the Coffee Cakes, how are you feeling? Anand, how are you feeling? Are you feeling the heart bubbling? Sometimes I make a lot of jokes. Are you feeling the heart beating like papa? Yeah? Are you feeling sweating? Those are now the drugs that are given in hospitals. You know, when you are given a drug and then you start getting palpitations, you start feeling your heart is pumping like poo, 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 poo. You have to get an antidote. You have to get an antidote of that drug so that you cannot don't want to say to shine on your way. Big up Anand, big up the Coffee Cakes, big up Coffee Cakes. Coffee Cakes has a new hit song, guys. Coffee Cakes has a new hit song. Sijo, Kiru, 818, big up yourself too coming in the chat. Amar Goda. boss, how is you doing? Rahul here. I'm still waiting for the Caribbean pirate, Jack Sparrow. I'm still waiting for the Caribbean pirate. Remy, the friendly bear, is here. Efasi Lipenga, my friend, is here. And, everyone is here looking at the doctor as I teach. We laugh, we feel good. You know that. As I teach, we laugh and we feel good. Consider the therapeutic index. I've always talked about this thing that is called therapeutic index. I've always talked about this thing that is called therapeutic index. To ERR is human, is it Coffee Cakes? What is that? Please be telling me that as I come. I'm going to bring something. It was just something over. You see, what is to EAR? I wanted to go and bring something. I wanted to go and bring something. Let me come, my friends. Yeah man. Who is still here? The doctor is in the house. The doctor is here, feeling good. Amar Goda, Ananda, Efasi Lipenga, and everyone is still here. So let's continue, my people. Let's continue bigging up everyone. Now, today we are talking about things to consider about a drug not being over the counter. So look at the package label. Look at the package label. The packaging may state prescription only, PMOM, per oral medication or RX. POM, prescription only medication or RX, or you write RX. If you see a drug that is something, this one I have a good pair. I have a good paper. Why am I just lighting things shagala bagala? If you see something like this, you know that is a drug that is not supposed to be sold over the counter. That is prescription only. You go to your doctor, get examined, get a diagnosis, then you get a prescription. We'll see. Those are the things that we look at. CJ Kiru, how is you doing, man? Do you have a channel, CJ Kiru? Subscribed to your channel. I have to check if I have subscribed to my people so that when they are online, I can see what they do, and when they come, yes, CJ has a super live, super. Yeah, man. So check whether it can be self-selected. General sales medicine can be selected by the public, whereas pharmacy-only medicine are not intended for self-selection. You see, listen, I read again. General sales medicine can be selected by the public. Yes, I want Panadol Extra. I want Panadol Extra. I want Panadol Advance. I want Panadol. The other blue one, I don't know how it is called. You know, me, I write components. If it is acetaminophen, I do acetaminophen. If it is the other one, I do it that way. So general sales medicine can be selected by the public, whereas pharmacy-only medicine are not intended for selection. Consider the potential for serious adverse effects. Medicine capable of causing serious or life-threatening adverse reactions are more likely to require professional supervision. Medicine capable of causing serious or life-threatening, that one I'm saying it very slowly. Medicine capable for causing life-threatening situations, they need what? They need supervision. Consider the potential for serious adverse effects. Sometimes you can give, Ananda's given me 100. Hey, Ananda, thank you, God. Thank you for that, Ananda. Bless up yourself. Thank you so much for it. Thank you so much for it. They add codeine with Tylenol paracetamol as well. Yes, those ones are not over the counter. Big up, Ananda, and thanks for considering this one. Thank you for considering this. Let me check. Let me consider saying thanks. Where is it going? Let me say thanks. Yes. Let's get on. The world is a cycle, going round and round, and everything you do is a cycle, going round and round, everything you do. Remember to pray, send the devil away. Yeah, my guys, everyone that here is my person. You see, everyone that is here is my person. We feel good when we interact and we talk. Now, consider the therapeutic index. Drugs with a narrow therapeutic index requires careful dosing and monitoring, making them unsuitable for unrestricted over-the-counter use. Drugs with a narrow therapeutic index require careful dosing and monitoring, making them unsuitable for unrestricted over-the-counter use. I talked about therapeutic index. Therapeutic index in a good way that I can say is, Ananda is telling me, please take some coffee. Yeah, I'll take some coffee, Ananda. And Arrow Abdi, how is the going, man? Abdi is here. Abdi. How is the going, my friend, man? How is the going, Abdi? Hope you are doing good. Abdi, wherever you are. I've been singing today. As I continue, I'll tell you about therapeutic index. Let me sing to the people again. Come on and every goodie, come on and hear what I got to say. Come and listen and I will tell you what is the talk of the town today. Cause in every corner that you may walk, you see a group of people talk. They are not skylocking, they are talking what's happening here in the YouTube space, man. They are talking about 8K hours and 1,000 to be and it is causing panic every corner, you know, because in every corner that you may walk, you see a group of people talk. They are not skylocking, they are talking about what's happening here in the YouTube space, man. Arrow Abdi, big up yourself. Some reggae vibes in the house, and this is the reggae man doctor himself. I treat you mentally, I treat you physical, I treat you emotionally, and I make you feel nice. The doctor of enjoyment. You know, someone called me the minister of enjoyment. Yes, we must all check our blood pressure. The minister of enjoyment. You feel good, you smile while I tell you, hey, take your medicine. Sing me a song by Wailing Souls. You know Wailing Souls, man. You know Wailing Souls. Which one specific? Yeah. Life with Marie. This is a special dedication to my girl Marie. Now I wanna sing a rap for you. This time I'm gonna love her around the clock. Non-stop. You guys, you know, today we are learning. Today is no feel good Friday. We are learning about over-the-counter medication. You see? Jah save us from Babylon. From Babylon brutality. Let me do this. Life with Marie. You know that song that I love singing for you. You know that song that I love singing for you. That song. This is a special dedication for my God, Marie. And the God for you. Say this time I wanna love around the clock, non-stop. Yeah. My big sister, my big sister is in the house, and I have to give her the salute. Shah Travels, Marie, the coffee cakes, Jamaican uncle. As we learn, let's smile. And I'm still singing. Come on and every goodie, come and listen what I got to say. Come on here and I will tell you what is the talk of the town today. Because in every corner where you walk, you see a group of people talk. They are talking about 8K watch hours, you know. The lights of the night and the morning. Wailing Souls, those are Wailing Souls, you know. Shack Attack, they sang a tune like Shack Attack, Don't Run, you know, Mighty Diamonds. Yeah. I can see I got some tunes. More blessings, my brother. Welcome, Marie. If someone is coming today and you know you have not subscribed to this channel, you know, come, I give you some topic. Hey, we can stop federal confusion. Come on. You know that song. The federal confusion. Today is no feel good Friday. People talk about the new drug, choosing to be happy. Yes, choosing to be happy is the new drug in town. You just don't take drugs. Always choose to be happy. Choose to feel good. Choose to be you. You know, choose to be you. You know. So today we are talking about consideration of the drugs that you know should be over the counter. You know. So let's get it on and say we go to the next point. So if you are coming here right now, you have no coffee cakes. Yeah, if you're coming here right now, tell your friend that Benjamin the Wise Guy, your friend, is online. And share the live, subscribe to the channel if you haven't subscribed. And if you don't know how to like the live, just double tap your screen like, and you'll see something doing. Jai Krishna, Radhe. Wandering wanderer, you are left wandering, you are lost wandering. That song I wrote. Fooling around in town, trying to settle down. You are lost, you are left wondering. The doctor himself making you feel good, but doctor don't want you to buy prescription medicine over the counter. So let's talk about prescription medicine. Here we can say, consider the therapeutic index. That's where we are. What is therapeutic index? Therapeutic index is how faster a drug can kill you in a good way. I'm trying to say it in a T-Beauty. The beautiful daughter of God is in the house, called T-Beauty. In a good way. I can say how faster a drug can kill you. Slap the doctor in the face twice, like the stream. Like ta-ta-ta. T-Beauty, how are you doing, my beautiful daughter in the house? How are you doing? Today people are talking about 8K hours. What are you talking about, T-Beauty? The YouTubers are feeling that is more pushy and pushing. Push up can show. There is a song that is called Push Up to the Show. But so today, as we go on, T-Beauty has put a new profile picture. Pretty. What the effect of codeine? Man, codeine has many effects. Codeine has many bad effects. Let me welcome. I'm always. Let me answer Arrow. Let me answer Abdi, and then we continue. But let me welcome T-Beauty. Let me see Coffee Cakes. And where are the people coming in and going? Like Dan. Yeah, like Dan. And Pretty, please share the live. Tell the people that doctor gives you a mental satisfaction. There's a song called Satisfaction. Effects long time of codeine. Tolerance. The body become accustomed to codeine. So high doses may need to produce the same effects. Physical dependence. The body becomes dependent on the drug. I see young people use it a lot. Addiction. Constipation. Codeine causes slow digestion, causes constipation. Nausea and vomiting. Nausea and vomiting. You just feel nauseated and you feel like vomiting. Drowsiness and reduced alertness. You are like a zone. Have you ever seen a person that has done this thing called what? This thing called marijuana. Is it like this? Is like this. This person, if he's a student, can read the same page 2 hours. The same page 2 hours. Respiratory depression. You feel like breathing is a problem, and that is what kills people that are addicted to codeine. Depression. You are there, you have taken codeine and cocaine, and there is no one who can help, so you lack oxygen and you die. Hormonal disturbance. Mood changes, sleep problems, and increase in sensitivity to pain. Sandra Sundarangi, welcome to the platform. A very nice platform that you see. You see beautiful ladies like T-Beauty. You see nice people. You see nice people like Raji. You see good people like Life with Marie, Coffee Cakes, Jamaican Uncle. So Sundarangi, welcome to the chat. And you know what we do. When you come in, you like the chat and you tell the people, you share. Telling people is is sharing and telling them, hey, the funny doctor is in the house. Let's go and watch him. So if you take codeine, sleep problem, liver damage with combined products like paracetamol, kidney problem and withdrawal symptoms, reduced physical functioning, falls and accidents, drug interaction, overdose risk, a dental problem, difficulty stopping the medicine, and if you are married, you will start losing your marriage because someone that you have married don't want a person who is high on cocaine. Yeah, those are the bad effects of taking codeine. I used to do marijuana, hard alcohol, but I'm 1 year clean. Pick up yourself, man. Thank you for leaving those things. Those things no good, man. Those things no good. So we are talking about prescription medication. Consider drug interaction. The drugs that you are taking over the counter. Raw. Yeah, Sudanese high. It's called Sudarang. It's called Sudarang, not Sudanese. Sudarang. Yeah, man. Sudarang. Consider contraindications. Is the medicine has important contraindication that requires assessment? You know, patient's medical history. Maybe you are taking another drug and it is not supposed to be taken with the drug that you want to buy. You see? I'm telling you these things, my friend. You gotta listen to me and nice. Listen to me and feel the best. Consider the patient's medical condition. Yes. Which, do you have hypertension? Do you have other problems like diabetes? You know, are you having an autoimmune disease? And when I'm talking about autoimmunity, you understand what I'm saying. Autoimmunity is not a good thing. It's not a good thing. Let's check whether it's an antibiotic. Now, here is where we have problems. Antibiotics. This is where we have problems. Antibiotics are medicine that require particular control because inappropriate use contributes to resistance of the bacteria. You just don't take antibiotics. Yeah? You just don't take antibiotics. Yeah. My good people, how can you just take antibiotics without control? You know, when you take antibiotics without control, when you feel some flu, antibiotics. When you have a wound, a simple wound, antibiotics. When you feel like your body, people say, I'm feeling that my body is not good. I'm feeling that my body is not good. Yeah? Let me check. I'm feeling that my body is not good. Let me go to the pharmacy and buy amoxicillin. Yes? The more you're taking that drug, the more it will, when you need that drug for sure, it will have attained what? Resistance. So if it is attaining resistance, what else will you use? Antibiotic misuse makes you not to heal faster when you have bacterial infections. So it is very important to check when you are using antibiotics, random antibiotics. Some people have taken antibiotics. You have several, like 7 types of antibiotics in your house, and you feel you are good with them. No, they are not good. If a person is giving you several types of antibiotics, please tell that person, no, please do a good diagnosis on my body. Let me know what I'm suffering from and give me one medicine that will make up with my body. Yes, considerations of antibiotics. Antibiotics are medicine that require particular control because inappropriate use can come up with antimicrobial resistance. Their legal classification should be checked rather than assumed they are over the counter. The regulatory framework specially provides for restriction on the drug and poison. But let me give you some classes of antibiotics. 1, we have penicillin, beta-lactams. 2, we have fluoroquinolones. 3, we have cephalosporins. Yeah, you see. And then we have another one that is called aminoglycosides, classes of antibiotics. Just imagine. You never knew, you thought antibiotic is just an antibiotic. Yeah? Classes, let me check all of them. Antibiotics. Classes of antibiotics. Penicillin, cephalosporins, macrolide, tetracycline like doxycycline, aminoglycosides, fluoroquinolones, sulfonamides, lincosamides like clindamycin, glycopeptides, the bapenems. You just listen. Monobactams, oxolidinones, and nitroimidazoles, rifamycins. Coffee cakes say some don't complete all medicine over. They stop when they feel better. Then the bacteria come back in 2 volts, or they save for next time without full dose. Yes, very bad. Polymyxins, chlorophenicals, and neutrofurans like neutrofurantoin. Just imagine more than 17 classes of antibiotics. And these antibiotics, they treat specific bacteria. And you are treating everything with penicillin, amoxicillin. And you see, amoxicillin is the first one. You see. So my people, let's learn how to consider if a drug is not over the counter. If you are still here saying, hi, the doctor, I'm still here watching you from this and this area. Let's get on. If you are still in the house, please salute. Say, Dr. Ben, I'm watching you from my kitchen. I'm watching you from my garden. I'm home. I'm going on a bus. Don't just be there. Do something. Text us on the chat. Tell us I'm new here. What do you do? Plumber job. A rule job. A rule George is a plumber. If you need a plumber, find a rule George. A rule. Welcome, and you hit the like button. Double tap. Give us your like and share us. Hey, Nafula. Hi, the doctor. I'm still here watching you as I fart. Okay? You want me to sing to you Mafurmbanya? Or you want me to sing to you Vida? Omwana inyanya, omwana mabere, omwana indumbu. My guys, that is my native language, I'm singing in my native language. Vida, omwana inyanya, omwana mabere, omwana indumbu. Indumbu is called the squembe. The squembe is the gluteus plus the soleus muscles. The coffee cakes is kind of like, what is the dog doing? Coffee cakes. Nafula Laleti, I think she comes from my community. And I'm kind of like singing for her this song. Nafula kind of like likes my beard, She looks at my beard and she feels, man, let's get going. Arul, where are you watching from? Which corner of the earth are you watching from? Coffee Cakes is laughing. Nafula is laughing also. Consider the patient's medical history. Even you yourself, consider your medical situation. Consider your medical situation, Consider how you are medically situated, You don't just be there. You don't just come in and you say that, I am let me see. You don't just be there and you say that, I am wait a minute. I am a doctor and I know what I'm doing. So ask the patient, do you have any medical history? Do you have any medical history? Nyahori. You are laughing at the doctor, The doctor is making people laugh. The doctor is making you laugh and feel nice. Efasi, oh, big up Efasi, big up all the time. Nyaori, which county are you watching from? Maybe Nyaori is watching us from Australia, from India, from America. Nyaori, where are you watching us from? In Africa, Morocco? Where are you watching us from? Tell us, my friend. Tell us, Nyaori. Tell us where you are watching from, so that we can interact. So we were talking about this thing that is called consideration of consider the patient's medical condition. Consider the patient's medical condition. Some medicine treat conditions that require a confirmed diagnosis. Before treatment, such medicine are generally not suitable for unrestricted self-medication. A diagnosis. Pneumonia is a diagnosis. Bronchitis is a diagnosis. Malaria is a diagnosis. Those things that I'm naming. Arthritis. I say I'm treating gout arthritis. Anemia, anemia secondary to kidney disease, acute kidney injury. That is a diagnosis. You don't just, before you do these things, you have to go to the laboratory, you take a blood sample, you come, you sit down, and you get the problem. That is a diagnosis, So you don't just give medication. Consider the patient medical condition. Get a diagnosis. For you to have a diagnostic criteria. CJ Okiru 81 telling Efasi Lipenga, greetings darling, how are you? You'll just listen, guys. People in my channel have good words. They are integrity men and women of integrity. We use good language. CJ Okiru 8180. CJ Okiru 8180. Just imagine. I want to repeat that. Some good, nice, respectable words. Let me. Efasi Lipenga. Greetings, darling. Just imagine. Greetings, darling. How are you doing? And then Efasi Lipenga will come again and say, yes, darling, I'm fine. I'm doing fine. What about you, sweetheart? Good vibes and good integrity words. My channel has good people that respect everyone. Thank God. Big up everyone that is coming to my channel. Here we come to feel good and advise everyone. So if you come to my channel, you know what to do. Here we talk freely, we feel nice, and we interact with everyone. And you ask someone a question, like you can ask you can ask the Coffee Cakes. By the way, the Coffee Cakes has a new hit song. The Coffee Cakes. You go and watch it in her channel, on her channel, a hit song. You come here as we learn about medical stuffs. You ask the Coffee Cakes. Yes, the Coffee Cakes. Your tune is marvelous. Then the Coffee Cakes feels, wow, let me go on and produce more. And then you ask the Coffee Cakes, oh, sweetheart, the Coffee Cakes, what inspired you to have this hit? The Coffee Cakes give you the story of her life. This is a channel whereby the interaction, the feeling good, makes us to vibe. Don't come here and feel that you are lonely. 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 I am the lonely. I call. You don't have space of feeling lonely in my channel. No, don't feel lonely in my channel. This is a space that we feel good. CJ says, yes, we must vibe. We don't, and who has not liked? We want to hit this 19 likes to 20 to that. Now, let's continue. You. Hey, The doctor, someone told me one day that, doctor, if you don't use marijuana, I don't know what God gave you in your brain. I told that guy, no, I don't use marijuana. I am clean self. Doctors are very dangerous people. They know how to activate adrenaline. You see, Nafula is looking at my beard and feeling, yeah. Nafula, Vida, I'll start calling you Vida. Yes, Vida. Nafula, one day we'll meet. No worries. You are in Nairobi. I am in Nairobi. We will meet one day and we will feel the vibe. Feel the vibe. Nafula is a part of the oath they take. Check whether it is an antibiotic. Check that medication that you are taking if it is an antibiotic. Now, have you checking? Have you looked at it? Is it an antibiotic? Yes, it's an antibiotic. So, what are the criteria of giving out an antibiotic? Proper diagnosis. Let me give you something. Now, Fula, today you are making me laugh my way out. Now, let me give you something. Bacteria that are on the airway, they are called aerobic bacteria. Bacteria that are inside the blood, they are called anaerobics. So these two bacteria, they are not treated by the same drug. They are not treated by the same drug. They are treated by the same different by different types of antibiotics, and that's how we select. We have anaerobic bacteria and aerobic bacteria. So penicillins are good. Penicillins are good for aerobic areas, inhibit bacterial cellule. Cephalosporins are good for inside bacteria that are in the bloodstreams. Macrolides inhibit protein synthesis and are good of course for the aerobic respiratory cases. So Nafula, are you getting that? Nafula. Nafula. Oh, there is something I forgot to do here, so my light has gone off, but it will come. No worries, it will come back. Now we are learning as we learn, and we are learning as we are making people feel good. Now, the other thing that I wanted to say is, these drugs that we are talking about, these drugs that are of importance in life, because if you go over the counter and you get the wrong drug, what does that mean? It means you may be bad. You may be bad. Check route of administration. I had forgotten that. Route of administration. Okay? My takeaway today is anaerobic and anaerobic in the blood bacteria. In blood, those bacteria are called anaerobic. They don't use oxygen, but in the respiratory areas, they are called aerobic. So, route of administration. Route of administration. Hey, how would I forget? But I've remembered that route of administration. Drugs are taken through different types of ways. Yeah, different types of ways. You may buy a drug and then you swallow. That is called per oral. Oral is your mouth. You are swallowing. Oral. You may buy a drug and then you go to a doctor, injects parental, intravenous. You may buy a drug and you get it in your gluteus. You know gluteus, the muscle, the buttock of the muscle. Muscle of the buttock is called gluteus. The biggest muscle that you have in your body is the gluteus muscle, the buttock. So that one is called IM, intermusculine. Then we have other drugs that are called atopic. Atopic. I'm still here in the background because I'm doing some little work around and inside the house, and my family and friends. Love you all. That is a clean self from Jamaica and uncle. So if you take a drug, do I have atopic? This one is a drug that is called atopic. When you have rashes, you apply. It has betamethasone. It is called atopic. We have another root that is called ophthalmic. Eye drops. Ophthalmic eye drops. But we have other drugs that are called otic. Who can guess otic? Who can guess otic? What is otic? What is otic? Don't go away. I want to bring more drugs. I want to bring coffee cakes. Well, I just want to go and bring, and you have named it otic, and that's why you have hit songs. Leo, let me bring a drug. Guys, don't move away. Don't go away. I want someone to like. Tell us, please. Don't go away. Just a minute. Yeah, man. So we were continuing. Otic, the coffee cakes has tell us. Coffee cakes has already told us. You take a drug, you put it in your ear. That is called the optic route of administration. Then we have vaginal. Vaginal. There are some suppositories when you have itchiness down there. Women, you take and then you put there down. I know some of you have used them. When you have infection, you put them down there. But we have some that are called rectal, you know how to administer rectal. Just like vaginal, they are called suppositories. Some tablets that you push down there. People with hemorrhoids use these things a lot. People with hemorrhoids, people with ulcers down the rectum, where the anus, people use them. They are administered direct in cerebrospinal fluid in specialized intrathecal. This one you cannot do it. It has to be done in an hospital. A good setup, administered directly into cerebrospinal fluid. Inhalation. When you take your child or you are asthmatic and then you put that thing here and then you inhale, it is called nebulization. You know, asthmatic people, when they are being nebulized, it means they are given that drug through the nose. It is called, it makes the airway open up. So those are routes of administration. Routes of administration. And why is it today people are not asking questions, what is happening? Or Nafula has made people to laugh a lot. Yes. We are still here feeling the 8K hours that is bringing panic all over. If you put down there, is it not painful? No, it's not painful. All those considerations are put on. In fact, it makes you relax. You know, there are some people who have ulcers down there and they are so painful. So when you put that tablet there, it. And these are called rules of administration. So there are drugs that are like tablets used for down there. You can not take them orally, like clotrimazole. You cannot take those drugs orally, my friend. If you take them orally, you are doomed. You will have bad stomach and go back to the hospital to feel good, to remove it. And also, anyone with any question like boss one is asking, if you put it down there, is it painful? Yes, women, tell us if you have ever used it. Tell us if you have ever used it. Was it painful? How was it? Most urinary tract infections that women go to the loo, sometimes some dirt. So you wash your inner pants and they are not yet dry. You put them on, then bacteria becomes a colony there. You start having infections. These are called an urinary tract infection. You might put those tablets and they go away. So women, boss has asked you a question. If you put it down there, is it not painful? If you are here and you can tell us you are a woman, if you have ever used it, please sensitize this man. Sensitize the men here. Check the strength and formulation. Drugs. You don't take drugs as food. Food. You take this food is so delicious. Until your stomach tells you no, where I can go again. Please stop eating. Drugs are not like that. Strength and formulation. The same. David Njoroge, my friend, here. It's better than getting kicked in the face with a golf shoe. Yeah, listen to that, boss one. Boss here, listen to what the coffee cake says. It is better than getting kicked in the face with a golf shoe. Yesterday I was watching Simply Kate. Simply Kate is a friend here in Kenya. She has a channel, and she was having a very great topic about some issues. And that thing, when you say it's better than getting kicked with the face with a golf shoe, I remember when she said the dad was so strict. And when I said my dad used to take me to jam session, hey, Kate who became surprised. How can your dad take you to jam session? So, Kate, where you are, big up yourself. Everyone, go and watch the Kate, Simply Kate. A very good mom, giving us the vibe. Funny thing, it's funny. If one has ever been kicked in the face, me, I usually laugh out of everything. I kid, I have done both. Just uncomfortable, but they melt. Yes, it's just uncomfortable, but they melt. The coffee cakes are said it's uncomfortable, but they do what? They melt. Bosire, have you heard that? Bosire one, have you heard that? Now, what we are continuing, as you come in, my guys, you are a new member of the channel, hit the like button. You don't just be there. Support the doctor by hitting the like button like David Njoroge has done. David Njoroge has hit the like button and I'm feeling, wow, I missed that live. Oh, Agnes Thomas, welcome to the channel. Today we are talking about things that you should consider. Well, these drugs are not over the counter. So you guys, Agnes Thomas and everyone that is watching, bless up yourselves, and you have, I have had. Bozire has had, boss has had. Welcome. Oh, the likes, guys, we are still hitting the likes. Let today give us likes. Let the likes go today. Let's give the likes. If you have forgotten to give a like, let's continue giving a like as we laugh and we feel. Agnes. Agnes, hi. Hi, Agnes Thomas. Hi. My guys, as we continue, we still have some, how many? We have 5 points before we close. Today, we said we are talking as people of integrity, dignity, and soft spotting. Like, yeah, like the one who said, "Hi, darling, how are you doing?" The Lipenga. So let's try. If you are here and you know how to talk, like, "Hi, how are you doing?" "I'm doing cool." "Where are you residing right now?" "Where are you watching the doctor from?" Where are you watching? Let's get the English going. Let's get the English going. I want to feel the English today. I'm an African. I learned English from school. But guys, give me the English today. Personally, some painkillers one should not buy from chemists. That's my opinion. Yes, we said that. Some painkillers, people should not buy them from the chemist. You see, I'm just getting some, let me see this. Oh, that's Shah Travels is still in the house. Don't buy from street pharmacies. Buy from a licensed pharmacy and people who know what they are doing. Yes. That is very important. That is very important. And as we come in, I can see people are coming in and they're not liking the vibes. You don't like how the doctor shouts and laughs? Come on, let's get liking. Let's get liking this video. Let's get liking this video, Let's get liking the video. Wagwan, me queen. Wagwan, me queen. Girl is a psycho. That one. Girl, you are my queen. That song was sung by Richie Spice. I'm so glad that you are my king. Yes, I remember it. Now, welcome everyone. If you are here, check if you have liked the chat. And today, people are speaking good English, good integrity, with integrity and dignity. So, if you come in, let's get the English going on. Let's get the English. As I talk about medical issues, let's get the Englishing. Now, route of administration, I've talked about them. Don't go to take suppositories and then you swallow them. My friend, you will feel the heat of the ear. Your stomach will vibrate randomly, like vibrating. Check the strength and formulation. The same active ingredients can have different classification depending on strength, dose, formulation, or pack size. Therefore, don't classify a medicine based only on generic name. Don't classify a medicine only based on generic name. Generic name needs company name. Classify a medicine depending on the compound, strength, dose, formulation, or pack size. Formulation means the component. If it is paracetamol, don't look at paracetamol. Look at something that is called acetaminophen, 1,000 milligrams. You see, if it is Tylenol, don't look at Tylenol. Look at what it contains inside. Ale, bless up Doka, big up ourselves, big man, Ale Wilson in the house. A friend, like an uncle and me, and really himself, Ale Wilson don't talk much. He's also a cool person who is always cool doing his things, He's not a big mouth like me. Me, I'm a big mouth. Whenever I go somewhere, you have to know the doctor is in the house. I shout out, Ale Wilson, bless up. Big up yourself as you come in. We love you. We love you, man. But let me laugh. But professional. The reason I said that currently, I just believe people should follow rules. Sense. I said that with due respect. Yes, no worries. I understand, David Njoroge. People should follow rules. In my hospital, we don't sell anything over the counter, even painkillers. We don't sell anything over the counter. At first, people thought it's a joke, and nowadays they are used to it. They usually say, if you go to that hospital, never given a drug over the counter. And it's okay. It's okay. It's all right. I'm gonna know how to handle it. 8K hours, my friend. Come on and every goodie. Come and hear what I got to say. Come and listen and I will tell you what is the talk of the town today. Cause in every corner that you may walk, you see a group of people talk. They are not skylocking, they're talking what's happening here in here in YouTube. And what are they talking about? They are talking about the 8K watch hours. Hey, hey, my friends, what you gonna do? What you gonna do when they come for you? YouTubers, 8K watch hours, and those that are monetized, you know the thing says 1,000 watch hours continuously, man. No dilly-dallying and no shagalabagala things. Around this time round, it is this time round is work hard for what you have to do. Work hard for what you have to do. Now, check the strength of formulation. Very important. Dose formulation or pack size. Check the official regulatory database list. Official regulatory database list means this is more reliable than relying to what a shop or key individual says. Pharmacy and Poison Board framework. These drugs have regulatory board whereby you can go to the regulatory like online, or you can text them and you check the regulations of the drug. You see, and you check the regulations of the drug. Are these drugs regulated? And then you read for yourself and you feel nice. There we run for you. Nice music. Yes, that one is a tune from the Morgan Heritage family. Why does ibuprofen work better for my pain than Tylenol? Why? You know, some drugs work different. You see, Brufen is an NSAID. Tylenol is stops prostaglandin. This one other is a non-steroidal drug. Brufen works better for inflammatory pains. Tylenol may reduce pain and fever and does not have much anti-inflammatory. You see, it is much more of antipyretic than anti-inflammatory. So as you reduce, Brufen is an NSAID, non-steroidal. So as it reduces inflammation, the pain goes down. But you see, Tylenol mostly may work on the prostaglandins, which is fever rather than inflammation. You get it? So when you have joint pains, menstrual cramps, dental pain, swelling, inflammation, Brufen is better. When you have stomach ulcers, kidney diseases, fever, you see, paracetamol is good, which is Tylenol. So that is it, my friend. So that was for coffee cakes. So coffee cakes, that is the jam. That is the yes, I can no longer take ibuprofen due to stomach ulcers. Yes, because it's an NSAID, it will continuously give you the burning sensation. It's almost similar like using a current AI system, where a client can send a rider to pick the drug from a very high pharmacy, but the rider doesn't have the prescription paper signed. Yes, and in Kenya, you know, those things were stopped. You can only order drugs online if you are a qualified physician or a hospital or a medical facility. These things of ordering drugs from your living room are stopped in Kenya nowadays. So you can take 1,000 milligrams of Tylenol instead of 1,000. No. The best option when it comes to paracetamol is 1,000. Above that, see a doctor. See a doctor above that. You see, That is it. Coffee cakes. Don't take more than 1,005. Take 1,000 and then see a doctor so that you may not exceed the one that is needed. You may not exceed one that is needed. Now, let's continue. You are right, doctor. Yes, yeah. In Kenya, those things were stopped. You can only order medicine online if you are licensed and you have produced a license to the distributor. Nowadays, those things were stopped. Check whether the medicine has abuse or misuse potential. Check whether professional counseling is required. Before you start, there are some medicine, when you start using them, you need professional counseling because their side effects may be like cancer drugs. When you start using them, you need to be counseled, and because of what may come, losing your hair, some effects, you need counseling so that you may not be stigmatized. Do not assume the availability without a prescription. Make it over the counter. So, we have talked so many things, my friends, about considerations. And next week we will start one by one about every type of over-the-counter medicine. As I say, David Njoroge, Coffee Cakes, everyone that is supporting me, big up yourself. And the new people like Ananda. FRC says 8K watch hours. YouTube has finished us. Let the marathon begin. Yes, just and active always on YouTube. Get those hours from the people that are online and are watching you. You get. Don't. I think YouTube has come around and said we have given people a platform, so for them to earn, let them even help us, because they have, you earn from adverts, and YouTube is paid from companies. Those companies, if those companies don't see the returns, they don't pay well. Great stream, very informative, and no gas here. Welcome. If you have joined the stream, please double tap the stream and subscribe. Thank you, More Cakes. Thank you, Coffee Cakes. So if YouTube is being paid from their people that are paying them, the companies, for adverts, and they are not seeing returns, they have to push their workers. Who is the worker of YouTube? You are the worker, plus the ones that are in the office. You are the one who is working for YouTube. As you earn, YouTube is also making money. So simple way we can know these things is prescription required, schedule and classification of the drug, labeled in the prescription drug. Most of the drugs, when you go over the counter, you will see them labeled prescription only. Risk of various adverse effects, important interactions, monitoring required, controlled dependence and potential, and require a diagnosis. These are drugs that require a diagnosis. Is it that I'm feeling hungry or I'm not feeling hungry? Yes. So those prescription, schedule and classification, label of the drug itself, important interaction, monitoring required, control and dependence potential. There are some drugs, when you take them, you can be addicted to them. They should be controlled. Diagnosis and requirements. Requirements of diagnosis. How are you giving these drugs? How are you giving these drugs? There are some children, these teenagers, one day when they are sick and they find out they take a drug and they feel good, they always want to be sick so that they be given that drug. You know that. So you always be controlling the kid about the use and misuse of these drugs. You see. Yeah. So guys, any question that anyone has, It is welcomed. It's welcomed as you continue struggling. Everyone that is here, addiction, yes, Ale, addiction. That is what I'm talking about. Addiction. We don't want children that are addicted to drugs, and the addiction started from the pharmacy and the hospital. Imagine you take your kid to a hospital, and then the addiction starts from the hospital. We don't want that. Doctors who are watching me, those doctors, I know sometimes they don't comment. They just watch as they some criticize and others clap for me. You don't help people to be addicted. You see, please, doctors, don't help people to be addicted. Help people to get away from what is illegal. To get away from what is illegal and addiction. Yes. So anyone who is here who has a question, my friend, anyone, tell me. Even random question. You just want me to go without answering even a simple question. Let's ask questions. Or not even a question. Say something. Say something inspiring. Yes, something inspiring. Say something inspiring on the chat. Say something inspiring on the chat. Say something inspiring on the chat, my friends. Something inspiring. Who has an inspirational quote before I leave? I think my time is gone now. Who has an inspirational quote before I leave? Anything inspiring. My friends, my people, anything inspiring. And those that have subscribed, thank you so much. I can see some people have subscribed to the channel on this live. Be blessed, everyone. Who is coming in and subscribing and making me feel wow, Who I'm waiting for anyone who has an inspirational quote before cute Jessie. Cute Jessie, where have you been? Let me ask you that question. Where have you been? I've been searching for you all this time. Searching for Lord, just for you. Hey, now that I've found you, please be true. Saying that no more sorrow, no more strength, no more heartaches, no more pain. Cause if you believe me, I swear I will. Yeah man. I'm waiting for anyone who has if you think you can or you can, you are right. Forgot who. If you think you can or you can't, you are right. Cute Jessie, where have you been? My brother, my sister, where have you been? Where have you been? It's been so long. So guys, from tomorrow I'm taking a break on medical talks because it's a Friday to Sunday. But the lives that I'll be bringing, they'll be proper lives, reggae lives. I'm going on a trip tomorrow, so be ready to get very many fine lives, good lives, lives of people dancing, people feeling good. I'm going somewhere to entertain myself and other people. So you will see the surprise. So cherish every moment in your life before it becomes a memorable quote of the day. Yeah, you see, those are things that we need to learn. Cherish every moment in your life before it becomes a memorable quote in your day. FRC, blessings to you and everyone in this life. Big up yourself, my people. Big up yourself, my people. And thanks a lot for coming on my chat, my live today. And FRC, don't lose me so much like that. Always be coming through, and let's be talking. Let's be talking, coming through, and we vibe. So, my guys, my time is out. It is 1.5 hours. Henry Ford said it. Yeah, nice one. Henry Ford. Cute Jesse, that's a quote from Henry Ford. So big up everyone, and I may say, what do I say to you guys, man? What do I say? Yeah, let's pray God and work hard. For those that are doing YouTube as a real business, let's support you guys. Let's continue supporting you every day. If I see Cute Jesse online, Coffee Cakes on, but Coffee Cakes has a new song. You go and listen to it and rate it per YouTube so that the ratings can go up. You know, Coffee Cakes has a new song. Guys, go and listen to that song. So everyone that has been here, can I say bye bye? Bye bye. There is a song. There is a Swahili song that Diamond Wasafi sang. I want to sing it as I go. When a dad is going to search for greener pastures in town and leaving the wife with kids, he sang like this: na watoto wakinililia, wambie pipi nitawaletea, usichoke kuvumilia na kila siku kuniombea. Usichoke kuvumilia na kila siku kuniombea. Bye bye guys, see you.